Alright guys, so yes, what you think? So guys, hey guys, what's up? I am actually on my way going to work, right? The Pamoya got work. May have some business to do, have bank for go, and for pay for my daughter glasses. Yeah, and myself, may have my glasses on, so for start out and my daughter one. Yeah. But anyways, as you look down in the title, sorry about the lighting, can't even see myself probably. But as you look down in the title, you know what it is all about today. You know? Look how me stay good, look how me look neat, look how me clean. Yes. So, guys, this is for all nursing students. As you look at the title, I know say exam I come up for you guys, and most I wanna nervous and something, right? Alright, well I'm gonna put on my mask. Yes, as I was saying, I know say when I'm nervous and everything, but don't be nervous. Don't be nervous at all. I'm gonna give you guys some tips. Brownstone, I'm gonna give you guys some tips on how to pass your span of duty exam. Most people who aren't nurses might know what I mean by span, but it is a clinical exam before you do the licensed exam, right? So you have to pass the clinical exam before we actually pass the licensed exam. So I have some tips to go on, and for persons who maybe their first year or thinking about to become a nurse, these tips can also help you not only in span of duty but in all clinical exam. I wasn't the best. I told you that I failed the med-surg like 3 times. I had to sit out a year and all of that. Went into severe depression because it's like nursing is something that I always wanted to do, and if you see my mother, whenever you usually have to take out student loan, but if you see my mother, I struggle and all of that for actually help me for school, and I could have passed, even though I try, I could have passed. But there are some actual tricks and tips of passing these clinical exams. So stay tuned, alright? See if I can get taxi, and I wanna find a place where I can talk to you guys. Yes guys, so I'm actually late for work and all of that. I'm heading, just coming from the bank, so I'm heading to Phoenix. I think a Phoenix Eye Center in St. Anne's Bay. Good people them, you know, to pay for my glasses and my daughter own. That's Mika glasses. And then I head to work. But the first tip is trusting God. If you don't have faith in God, nothing is possible. Nothing at all is possible. You know? And have to be a religious person in order to have faith in God. Good afternoon. You can be righteous. You can be righteous, pray, and we don't say live good, but it's kind of hard to say live good because sometimes you try to live good with some people and it doesn't work out, you know. But live good with people you can live good with. Eat healthy, get your rest, not only study and not only say you will study, eat, sleep, go to school, go to hospital. You know, work out. Life is very expensive now. I mean, know most of you are planning for graduation and I save up for graduation and all of the curfew and something. But me with my struggles throughout nursing school, what I did, when me accomplish 1 week, me buy myself 1 chocolate. Cause I love my belly, you know. Yeah. Me buy myself 1 little chocolate and something. So, number 1, remain faithful to God. Without God, you can't go. It's hard to make it through. Right? Number 2, eating healthy, remaining healthy. If you can't exercise, me actually want to start back exercise. Me exercise when me finish up, just see. Because me never want to go back to depressional state or something. Yeah. Thirdly, study. If you not study, it not make no sense. You don't have to study. You have to study, especially pathophysics and all of that. You know, come to hospital and me know it's hard and something. And sometimes, hi, good afternoon. How are you?
Good. How are you doing?
I'm good. And sometimes it is hard to focus on your exam because you have to do total patient care. But let me say something to you. When you get to 2 or 3 patients or 1 patient a daytime, write down on a patient information, write down labs, write down diagnosis, write down treatments, write down medication. And when you go home and you study in a pathophysics, because let me say something, it's not that I am bright or I was the brightest. If you ask any of my colleagues, 4 years, it takes to be a registered nurse, and it took me all of 7 years to complete. You understand? So, me make it, and Una can make it too. What me want to say? Go home. Study on the medication, on enough to do what me did notice. Yeah, it's Phoenix Health Complex and Vision Center. And that's right at the health center in Hansby. So I actually stop off in order to go make the payments and then I go work. Right? So yeah. I see how short me video can be, but me really want to help out you guys, and trust me, me know the video might be long, but you know, listen up. Another thing, what I used to do, me do at least 1 care plan a day or 2 care plan each day when me come hospital, when me go work. And me show, me no feel comfortable 1 person. Me show 5, 6, 7 person. Me say, what you think about this? Because me tell you something. If you not practice care planner, you can't depend on somebody to help you when at exam time. Because what if you don't get help? What if you have to stand alone? You have to prepare enough for exam where maybe you know go see one nurse say, give me 1 intervention, give me 1 evaluation, give me 1 outcome for diagnosis. No, you know, must find somebody for help, you know. You understand? So, So uno have play smart. Uno can't procrastinate. Can't do that. Can't do that none at all. Alright. Another thing too. Uno skills, dressing and medication. So this is where I am. Actually, I looked across the road. Uno skills are very, 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 very important. Without the skills and everything, uno can't pass. If I never perfection with my skills, I would have never scored enough to help me to pass. It was because my care plan wasn't good. My care plan was horrible. You understand? But it was because of my skills that had allowed me. That's the medication and the dressing. So I'm going to give you some tips on dressings and tips on medications. Yes guys, so I'm at the Phoenix Medical Center and also at Center. Yes, so I actually yes, I did. Me do all of that from before me come in, you know. So great staff, you know, as what I was saying before, great customer service and everything. And they always call, you know, always call and ensure say that you keep up to date with your appointments. And yes, as me say, my daughter came here as well and they were patient with her, especially with choosing her glasses. So just to make my payment, and I'm gonna try in sunglasses and show you guys. Remember, you know, me have work, so I'm gonna be quick. Alright, so stay tuned. Alright guys, so yes, what you think? I actually love this one bad. This one is nice. Yes guys, I love this.
It's cute.
But something with that one here, we kind of with my complexion.
This is a big one.
You see it? The color.
We have a purple to it. And the shape is different.
I love this too. This is nice.
You can try this also.
Java hat is simple and nice. But the other one, they're much.
They're more
Yeah.
trendy.
See the red one here? No. Catwoman.
Nice. But maybe I like the
You see this nice, you
color
know?
nice,
But because I work, no look bad, you know, but
you can't wear that color.
it can wear, you know, but it look too.
Because you see, I don't understand the bright colors.
This is nice too. Alright, so is either this. Yeah, for help me choose, my husband and them. They help me choose.
Like that.
Either this or this.
Put on both of them. This. You know the pink one just, yeah. That one nice too, but the
lighting kind of bad, you know, people. Really bad. But me, the home, just bathe and all of that. Yeah. Just bathe and everything. So I am in it. Hi. Alright. Just bathe and wash my face and something, but my face a break out back. But you know, the product still a do its job. You know, female stress every month with skin with face breakout. But anyways, let me go into the medication and the dressing tips and tricks. For dressing, what I did, I ensured I had my rubric, yeah, or yeah, the rubric, or what you call it, the sheet. Oh, you guys supposed to know me I thought the sheet will not have where the examiners use to grade, you know. Yes, not for go fancy. And then me ask my own colleagues, them other nurses, and me tell them for grade. Me tell them say me do one of them dressing and don't use that water. Let me use that dressing and something. Me do the dressing and watch me do it and something. You know, as registered nurses, if frustrated doing no call. Remember, me never be a registered nurse before, so me never understand when if you have 2, 3, 4, 5 students if you attend to and something kind of frustrated. So me give up. So me kind of give thanks to the nurses them who actually used to help me, because it's hard, especially on a ward like when me depend. Yeah, it's hard, very hard, very, very, very hard. If you have like a 10, 15, 16 or 17 patients, and then if you find time to attend to other student nurses. But yeah, you have your schedule, you have your rubric with the marking scheme and everything. Yeah, you know, the asterisk, look asterisk them will show you say this is what marks the most and all of them something there. Yeah, ensure you have that, you know them points there, or you know them part there where you know say it workable. Another thing what me used to do, me used to make bandages out of tissue and have me look at tape them and something. You know, and me used to go home and bandage up my daughter, bandage up my husband and something. I was stay at night time and me practice. Me make my husband use the marking scheme and practice and practice and me practice. One of the tips, some of the tips are the tricks. Yeah, some of the tricks now, me give on tips. Some of the tricks now. Think about dirty and clean. That's all you gotta think about. Dirty, clean. If I put my hand below my waistline, it is dirty. And if I put my hand above my waistline, it is dirty. You don't want to stretch over. Stretch yourself. Try to prevent stretching yourself over the dressing set. Right? Try to say your dominant hand, that's the hand that you use to wipe or clean, whether you're left-handed or right-handed. I am right-handed, so may I say yes, this and my dirty hand because I can manipulate the forceps good. Another thing we need to touch. You see them forceps there? We make gonna feel. Test out on a forceps before you start clean the patient or attempt to start squeeze out on a cotton or on a gauze. Test on the equipments first. If you realize that the equipment get trouble, don't close it. Barely take up the cotton them, not closing the forceps, and then you squeeze and you know say easy for open because you not lock it. Remember me telling you? Remember again, me see most of you do it at hospital where you not have a friend be the clean nurse. The exam is one man thing. So you have to know say you got to prepare everything. And know say if you not prepare everything, what and how are you going to get it done without contaminating the sterile field? What is sterile field? Sterile field is the cleanest parts. So the gauze clean, the gloves clean, even the patient, no matter how body smell or if maggots in it, you still have to identify that wound as clean. Because at the end of the day, even though it's infected, you're trying to get that infection out. And once you contaminate your sterile area, you're basically contaminating the wound back. So it not heal. Sometimes you wonder what happened to the patient, why the patient's store not dry up, why he always a pussy, a ooze and all of that. It's because proper cleaning is not done. Alright, another trick. Right? Another trick is to have your tapes prepared. Don't only prepare 2 pieces of tape because you know say alright you're going to use the crepe bandage and wrap so what. Plan smart. Just as how you plan, you do your care plan. You do care plan when you do dressing. Look on the wound even before your examiner arrive. Because by then, well sometimes they switch on you know. But before you even tell them say you're ready and fix up with something, look on the wound when I will dress and have an idea. Judgment. You're supposed to be able to look and say, alright, I'm going to need 2 roll of crepe bandage. I'm going to need a big something because at the end of the day, you know, and you do your dressing and you feel not contaminated and everything is okay. If your dressing not neat at the end of the day, the man say no one but this nurse untidy. This nurse not going good. You know? Yeah, so get more than if you know say alright, some people say some examiners will say you need 2 gloves, 2 sterile gloves. Get 4 sterile gloves, put it on your box. Get 4 sterile gloves, put it on your trolley if you say. Get 1 box of gloves, unsterile gloves. Or if you can't get no box, get all 6 pair. You get me I say? Get all 6 pair. Have as much equipment so that you don't have to leave your patients. Because you will get mad on for that. Right? One other thing. Remember, the patient has the rights. The patient has the right to say no. The patient has the right of privacy. Remember, you're doing an exam and your examiners has to see you dressing your patients. So you can never go to your patients and ready to do your dressing without your patient even. I wonder how the hell so much people they look for me. And trust me, Yeah, you will feel the exam in that way, not because sometimes your examiners will bypass it and not realize. You have some people who bypass it and say, throw that to at least. But then again, the patient themselves will go on and weigh upon you. We behave a way. And even when you say it to them, then we act like say you never say nothing to them. Because I remember in a med-surg exam, and I had a diabetic patient, and this patient supposed to get insulin 30 minutes before he eats something. And then tell them I didn't understand about diabetes good and insulin. You understand? Me never understand between when it's a soluble insulin. Me always wonder if a 70/30 or regular insulin or, you know, me don't know which one fit take up. So it's like me say to him say, hold on, come here, me say, alright, since me don't know, you know, I mean what's the medication I most thing for me pass. Me go see if I find one nurse round the corner and beg them and say to them, say, which one of the insulin here? And pull you up with the nurse. So me see the man getting breakfast and everything. So me say to him, say, sir, don't eat before, don't eat anything. Right? And me say to him, say, sir, don't eat nothing. Man said to me, say, no, man, me not do that. I know say you exam me, I do. Me not make you feel nurse. Not make you feel. And you see, me only hear when somebody a cry out. Me examiner say, Nurse Shaw, where is Nurse Shaw? And I say, oh, why this a woman a behave so? When me got the patient, me see, don't eat and depend the melon. So me say, have the insulin in my hand, me have my tray with my insulin and everything in my hand, and my chart and everything. And I say, sir, didn't I tell you not to eat? And so me never hear you tell me that. Yeah. So always try not to let your patient set you up to fail. Be careful. Be careful, especially the men. They are hard to deal with. Very hard for deal with. Another thing about dressing. Yeah, you introduce yourself to your patient before the examiners them come. You say to them, say, alright, me have one exam, so whatever. You say, you not feel no pain. You check your order, you check everything and ensure, say, you know, if a papaya dressing or you have to go get some antibiotic or some cream to rub on it after. If the dressing is supposed to be dry, where you just change the gas and put on one new one, or a dry to wet, where you take coffee and you left, you know, damp dressing on it, or a wet to dry where you use normal saline and clean and then you tap it dry and that's it, you know, or you have to irrigate or whatever it is. You have to know the patient's order. Here's a trick. We don't practice that. We don't practice that. I don't know if we practice it overseas, but it is hardly practiced here in Jamaica where a patient's dressing order is done. Maybe the doctors them write it. I'm not going to say the doctors didn't write it, but sometimes because we used to this patient, we not bother check and say, alright, let me check order. We don't really do it because remember we are on the ward, but you guys are just nursing a patient, you know, just do the patient dressing, you don't know much. So the doctor not gonna really write one dressing order, and sometimes it's not too up to date. Even if the doctor writes it, the date is expired. So the trick is, before you attempt to do your dressing, you will say to the examiners, hold on, let me find out my patient's dressing order. When you find out and you don't see no, you know, go to them and say you don't see no, you know. Can't say that you are independent nurse, you're not a dependent nurse. Remember, say that exam, I show them say you're ready for the working world. So what you gonna do? You go look one doctor and you go say, doctor, write up one dressing order for the man quick. Sign here and put the date and everything. And you do that and then you say, alright, that done. You understand me? 3 days before your exam, go up go get your dressing set sorted out. 3-4 days. Make sure your dressing set sorted out. Make sure you even ask one nurse. Nurses have them lock on them little drawer. And you say, nurse, put on the dressing set. Your nurse, put on the normal saline. Nurse, put on the 2 pair, because you don't know what will happen on that day. It don't make sense say at exam time and you don't have equipment. You're supposed to be ready. So your needles, your syringe, you don't need to take them home. Ask one nurse to pop them up, have one little goodie bag. And you walk with everything and you say, nurse, put this up, I have exam. And you beg your nurse put you up so when you exam, your gloves, everything ready. That's what I did. I had everything for my exam in one little bag, where other nurses end up had to use out of my goodie bag. Right? Alright, now another thing is remember, introduce your examiners to the patient, do the order and everything. Normally, before the whole COVID thing, we used to ask them to talk to it first. Always ask the patient about pain. You don't want to put the patient under extra discomfort and pressure while you're doing their dressing. So always find out if they are on any analgesics, either Voltaren, the Bethadine, the Parocodenc, or whatever it is. They're on for pain management. Ensure pain management comes first. Remember, you know, a plan of care, your intervention, which one come first, which one is priority. Dressing, yes, is priority, but pain come before dressing. Pain come before infection control, yeah. Right? So ensure you do that. After you do that, now and everything, you show your order, you ask the permission, you read the date for your something. Always remember to open your dressing sets properly. You don't want to end up if you stretch over your dressing set too much. So you go at the little corner, you start and you pinch. You have to be stushy that day. And you pinch and you take it over. And then now it always open from you. Don't open this and then you have to go stretch over and open it. So always open your dress, turn the dressing set good, always open from you, and then one look part of the face to cover the inside part, and then you go open it. Always try not to let your uniform, your gown or whatever touch the dressing. Stand at least 2 to 3 inches away from the dressing set and the trolley and all of them something. Ensure to have your little box with your red bag in it. Ensure to pack your shelf right, and everything where they are top fit their bottom, and everything where they are bottom for their top. Alright? Always, even your tape, be careful how you put your tape. Remember, say on the top of your trolley is the clean part. If you're going to paste the tape on the trolley, use like not on top, paste it like two. Like, see the surface here? Paste it like here, so. Don't go up on the top of the surface. You understand? So, we might have to go do one other video just for dressing and do one video just the medication, because I have a lot of stuff to tell you guys. So, I don't want to be long and have this video going for 30 or 45 minutes. For medication, it's basically the same thing, patient privacy. But medication is more in depth, because guess what? You have to know your pathophys, you have to know how to calculate, you have to know patient safety in all area. The ethnicity, that's where the ethnicity comes in, and all of that. The code of ethics. That's where it comes in. You understand? Remember say, you can make a mistake with dressing, even though if you fail dressing, you fail the entire exam. If you fail medication, you fail the entire exam. But medication is the worst part of it and the most important part of it, because guess what, they might watch you feel, because guess what, they want perfect nurses in the medicine field. Me know they say nothing not perfect, they don't need perfect nurses. They don't want, we have to kill off other patients. Remember say them a pass and them a fail, so at the end of the day, it look bad upon them, because at them pass we and say yes, we're capable of going out in the hospital field, in the medical field, to treat and take care of the sick. You understand? So guess what, I'm gonna wrap up this video. I'm tired bad. Yeah, as you realize, Trace and me kinda in this video, we were supposed to vlog some good up things and all of that. The vlogging regime is so poor, guys. Oh my god, we're tired. Me cause school work, Trace work, me work. I have to come home, cook, clean, tidy. If we have split up the chores, them, we have so much plans. We have all kind of something go on, all kind of something. So we're kind of busy, but we are gonna try our best. Even once a week, we post even one video. We are gonna try. Love stay safe. Mega post part 2 of the video here. This need part 2. Guess what, girls? Guess what, males or men? Guess what? If you're watching this and this video had helped you, please come on, subscribe. If you subscribe already, thumbs up, like my video now, share with another nursing school, share with another nursing student. Great contents is about to come your way, and span of duty is next month, guys. We are going to talk about RENR2 for October. Guys, come on, share this video, don't be selfish, and like, if free for comment, you can comment, you can criticize. Let me take constructive criticism. Yeah, love you guys. Thanks for watching. If you had made it to the end of my video, sure say you're a real fan of Sadie. Love you. Peace. Alright guys, so I just reached at work and all of that. End up after do a video them in a parts, piece and all of them something there. But anyways, miss so I can hurry and talk just to wrap up the video. On medication, the first thing you have to know, like the 10 rights of the patient. For example, when you do exam, now wait until the examiners then come, you start look for your medication, right? Make sure for the 3 patients them that you have, you look for all of the medication them, put them down, because you never know which one of the patient them you'll get exam on. Make sure the expiration date is there. Make sure the treatment chart and the drug chart is present. It sign properly. The date of the order is there. You understand? So what you going to do, what me do, me normally go to my patient first when me decide who me go medicate, and say to them, say, so me go medicate my patient. Alright, let me run through quick. On the 21st of June 2021, doctor ordered 1 gram of pethidine to be served twice daily, right, for 1 week. Right, it is now 20 minutes after 9 and the patient is now due for their morning dose of metformin. You do the RBG and all of that, and you know RBG is okay and everything, and you go check and all of that. Where you're going to ensure your patient have the ID band and all of them something there. You go at the bedside. No, first you're going to a treatment room. I don't know how all of the hospitals set up, but me know you have a treatment room or a drug room with medication and everything. You go do your first check there. After do your first check, your time, the signature, you compare against the cardex and all of them something there. The treatment chart and the cardex, you make sure both of them are saying the right thing. So you compare the name, you repeat what the treatment chart say, and then you say what the treatment chart say and repeat it on the cardex, because you have to compare, say the right something, right? Also, when you do that now, at the end of the first check, you dispense, you do your calculation and you dispense. So as you know, metformin normally come in a 500 milligram. You go put the order, the desired over, so doctor order 1 gram over 300 milligram. But there's one thing, you have to go change over the milligram or the gram. You understand? You have to go change over, but me feel like say it better you change over the gram because it's more easier. So more than put 1000 milligram over 500 milligram times 1 tablet, right? You know, when you do your thing and you divide the 500 into 1000, you get 2. When I get that now over there, so you times the 2 times 1, right? I don't know if I say it right, you know, because I tell me I'm not the brightest, but I kind of have a clue. So I don't know if I 1000 over 500, yeah, I'm right. So the order over what you're having and times the unit or the volume. You do all of that, you take out your medication, you go through the second check and the third check always at the bedside. Before you do your third check, me advise you know, go introduce yourself, check ID, check for allergy, all of them something there. Tell the patient what you're going to do and all of them something. If you know you're not going to remember for do your third check, do your third check first before you go to your patient. If you know you're not going to remember. If you will remember, you can do it. Introduce the examiner and then at the bedside. Or you know what? Do a third check first. So do your third check and all of that. Ask about allergy, ask about this, ask about that. Always ask permission for the examiners to witness you. Either injection, pill, anything. Always ask always ask your patient permission to have the examiner's witness. Explain to your patients, I am doing an exam. They have to see me give you your medication and all of that. Is it okay for them to watch? And you see it in the presence. If they say yes, if you have, well, normally 2 examiners, you're going to introduce, these are my examiners, their names are whatever. Yes, so that's basically after. Remember, after you administer and you do things right, you're going to say to your patient, remember you tell them about side effects, you know. You'll say to them, say, all right, you know, so 30 minutes or 40 minutes the medication will then dissolve and start take action. You know, always know the time route of medication and all of them someday. And you know, say take a time, so always tell your patient in front of your examiner, I will check back with you. Also, let me remind you, no bother go with the examiners, go give people medication. Remember, you're not a registered nurse, you're a student nurse. Remember, the examiners are not on the ward as registered nurses. They are examiners. Understand? Always have the nurse that is assigned to that patient with you right through. Anything that you're doing for the patient, remember the nurse has to be there. Alright, so even when you do your first check and your second check, ensure you call the nurse. Don't forget, even though an exam, they has to be there. The examiners are testing to see if you are compatible of being an independent nurse. And an independent nurse is responsible. You're going to know, say, me not have my license for practice medication, so me, I do the right thing. That's why I always need to practice the right thing before I actually end up and do it. Alright? The dressing are basically the same route. Right? When I go contain on a sterility. Make sure in a sterile feel. Guys, me go through one dark area. I try go up on the unit and all of that. Ensure when a field is sterile at all times. Right? Me might make one video. If me have time, I'm gonna make one video and make one video about medication administration, and me can do a video on dressing. You understand? So this is my ward that I work on, male surgical ward. Yep. And if I can see good. And as I know, I see my hairstyle. Yes, this is done by Jenelle Jenelle Maxwell, and she's on YouTube. Your guys, see it here. She did a good job. I actually love it. But you know, I have to wrap it up for work. So guys, ensure you check my description and subscribe to our channels, especially if you want to be able to braid or whatever you want to do to your own hair. She will guide you. All right, take care, bye.